Welcome to Catalyst for Healing. I'm Maria Lloyd, licensed marriage and family therapist, and I'm here today with a very special guest, a friend of mine named Saturnino Iniguez, and he's a licensed marriage and family therapist who has a private practice in Westlake Village, California. He is a proud husband and father of two little girls with strong beliefs that psychedelics can help people heal. Nino, because he goes by Nino rather than Saturnino, works at the VA doing research with MDMA and veterans with PTSD. He specializes in trauma work, autism, and psychedelic-assisted therapy. So, Nino, I'm so happy to have you here. And why don't you share a little bit more about yourself and what got you into this field of psychedelic assisted therapy?
Born and raised in California. Moved around a little bit, but stayed in Southern California for the most part, and then decided to do my private practice close to where I live. And I would say the journey has been interesting. It's gone many places. I started my therapy after graduating and everything probably around 2013. So it's been about 12 years now after graduation of me practicing and sort of finding my way. Anything from behavioral consultant and BCBA sort of training work to treatment centers for teens and adolescents and young adults to private practice. It's been sort of all of those things.
In a lot of environments, which probably gives you a really broad range of experience.
Yeah. Actually, I think, looking back, some of those things that I just was not really thinking were going to be my, I don't know, work ended up being a big part of my work, especially the treatment center training. That was intense, but also very helpful. So yeah, and then, that sort of defining point of COVID came, and that was a little after I'd started a private practice. Everything just, stopped. And I decided, might as well take the time to learn some new things. And I started to focus in on trauma work. And then with that trauma work led a lot of, mindfulness work, somatic work, a lot of the body stuff, which was the stuff that I hadn't done before. A lot of the things I had trained in was cognitive behavioral therapy, DBT work, coping skills work. And then to see this whole other side of, the somatic work, it actually really blew my mind. And then that opened the door to finding psychedelics. It actually, I
I think
guess,
we've been on a similar path with that because it's like around 2020 where same, really done deep dive into the trauma work with clients. And then the somatic was my first thing where I was like, wow, the power of that is incredible, right? In comparison to just working with up here to be able to work in the body. And I think naturally it really connects well with the psychedelics. Why do you think that is? Like if you could explain that a little bit, how the body work is connected to psychedelic healing.
Yeah. I mean, that's sort of interesting, right? There's sort of two answers that come up straight away. One is, my own personal experience with it. And then, what you come to understand through all of the trainings and everything like that. So I would say the body and the mind are just so connected in general. And if you're utilizing a psychedelic, it's going to affect all of you, not just a part of you. And so the body and the mind, just because they're so intertwined, yeah, it's going to affect all of you. And, I think after learning a lot about trauma, you come to understand that trauma is something that is also affecting all of you. It affects your gut. It affects where you hold memories. It affects how you hold them. It affects your responses to things, your anxiety, all of that stuff. So in some ways, I would say, yeah, it can definitely do a lot when you're not understanding the trauma. And then psychedelics can come in and really put a reset on things, body and mind.
Right. So kind of with that too, we had talked about you being willing to share your own personal story of how your experience with psychedelics. So are you still open to doing that today?
Yeah, absolutely.
Okay. Yay. No pressure. But I know we had talked about that. Yeah.
Yeah, I mean, it was such an interesting thing, right? Because I think in some ways it starts before you even ingest anything. So my path was going through a year-long certification with a school out of San Francisco called CIIS. And that certification was very in-depth. And we're in California, it's not legal to take, psilocybin or a psychedelic other than ketamine. And so I decided that to fully understand it, I also needed to ingest and really experience it. Then there were all these other pieces. There was me coming to understand that it was actually part of our family history, that my, let's say, great grandparents were the shamans of a small town in Mexico. And
Mhm.
this plant medicine had been part of my heritage, my lineage since then, beyond that
You
time.
didn't know about that before?
I didn't.
Wow, that's amazing.
And so that training with CIIS, part of it was you have a mentor and you talk about things. And what we ended up talking about was I needed to know more about myself. And
Mhm.
so I started asking questions and looking into things. And I found that and was actually really surprised that I sort of ended up in that same category as some of my ancestors,
Yeah.
wanting to understand the plant medicine and utilize it for good. So when I did end up taking the psychedelics, specifically psilocybin was the first one that I took. My experience was very eye-opening, life-changing, very scary initially. I think to sort of like fully let go and have that sort of ego dissolution and understand that you can't control some things and like actually let go. I brought tears to my eyes, shakes in my chest, like all of that build up to that moment. And then actually starting the process and knowing that there's nothing I can do now. I'm going to
Yeah.
have to ride this wave. I saw a lot of memories from my past. I saw a lot of connections that had both healed me and helped me grow that I had never seen in that way before. And I felt a lot of love. I think there were some visuals and things like that, but the majority of what I was going through was moving past the stuff that was there for me to move past. I think there's a concern
Mhm.
that there's like going to be a bad trip, and I get that. And I also
Yeah.
hold the thought and the belief that we get what is meant for us when I try to take the idea of bad or good out of it. And so actually trying to do that in the moment was so interesting, yet so powerful. So,
Mm.
yeah, I think the two moments that stood out to me was one, the connection to where I was and the nature around me. And then I had already had my first daughter. And I think my connection to her and my wife towards the end, that was what I was thinking about, just how much I wanted to be with
Mm.
them, connected with them. And so those were the two things that sort of stayed with me, which was pretty,
Yeah.
yeah.
So the two things you mentioned, I just touched on is one is the bad trip. And can you help explain? Because that is, I mean, again, this isn't legal except in Colorado and Oregon right now, but I think that is people's biggest fear around psychedelics in general. Can you explain a little bit about what might constitute a bad trip and why that might happen versus um, someone having, like you said, whatever they take out of it. But there's certain circumstances that might make a bad trip more probable. Maybe you can explain that a little bit.
Absolutely, yeah. So I guess this actually would be kind of part of what we were trained to know and understand, which is the three pieces to doing something like this. So we have the first, which is preparation, helping you to
Mhm.
prepare. And with that comes understanding the mindset and the setting. So those are big words. You'll hear that a lot, set and setting, which means mindset and where you do it. Those play
And
a
who you're doing it with.
yeah, yeah. Who you're doing it, where you're doing it.
Yeah.
And back to the body, like what's in your body at the moment. All of those play a big role. And so when we're thinking about helping people to experience this in a way that can be just full and something that can be movable. I think sometimes people feel stuck and then that's when it can get scary. They feel overwhelmed. You want to do a lot of preparation, understanding your intention, what it is that you want to get out of this, what it is you're looking,
Mhm.
what's on your mind. You want to be able to understand, like, do what makes you feel comfortable, what doesn't. You're right, the person or people that you're with while you're doing it, and any sort of outside or external stimuli. I would say, let's say, for instance, mushrooms, psilocybin
Mhm.
mushrooms versus MDMA. The setting and the external stimuli, I would say there's going to be differences. I would not suggest going to an all-day music festival on, a
Right.
legitimate dose of psilocybin. That can
Mhm.
be very overwhelming. Your senses will take in so much and it's going to overload the system possibly. So things like that play a big role. Um,
Right.
And
And
then,
people using larger doses in general on their own. What is your feeling about that? Because it's so, I mean, it's so common right now, especially with the younger people, in terms of, mushrooms are natural. So why not just do a big dose and go out in the forest? And what are some of the risks with that?
well, I mean, risks are if you're taking that big of a dose for psilocybin, you're going to probably encounter altered thinking, ego dissolution, deep introspection, and you may feel some anxiety as you move through these things, as your body takes in the fact that the perception of what is there is different now than what you're used to. So just taking all of that into consideration and then plopping you into an uncomfortable setting or in the middle of a forest by yourself, it's just a lot to take in. I would say, like psilocybin mushrooms, I understand that they can be used for just relaxation, a fun time at a certain dose. But if it is that you're going to be taking, let's call it a hero's dose or a large dose, yeah, you would definitely want to consider the fact that your mind's going to be going through something that by itself is enough. To
Yeah.
add in all the external pieces, it's just going to be difficult, possibly.
Well, and if something scary comes up, but then there's not a person there to support you to work through that or integrate that experience. So it could be kind of traumatizing in a certain way, right? If people have scary experiences on their own.
Absolutely. I think even though it's very possible that that can happen. There's also another part to psilocybin mushrooms that I love, which is, one, there's a very low risk of it causing, like death and serious injury to you. We try to stay away from doing things like that if there's already heart concerns, but in general, it's not known to be a big serious danger. And once it wears off, depending on how much you take, between 6 and 8 hours, um, people are known to not be as affected by their quote unquote bad trip. But then that leads to these other pieces, right? So there's the preparation, which includes the set and setting, then actual utilization, where you're ingesting whatever substance or psychedelic, any of that plant. And then there's the third part, which is the integration. And that would be another big factor in helping
Mhm.
people to make sense of what happened and it not lead down this path of I had a bad trip. Some meaning making in that.
Meaning making is really important. Yeah. So
Yeah.
you have the experience. Well, okay, that was the other one piece I wanted to touch on. So you mentioned ego disillusion twice. And just to explain for people that don't know what that means, like what was your experience of ego disillusion or how do you define that? Because that's a big part of psychedelics in the language people are using.
Yeah. Yeah. I think that my experience of that was and everybody is different. I would say what my experience was, I know as I even begin to say this, it might sound like a lot to some, but my experience of ego dissolution was coming in the form of death and actually
Mm,
accepting that I could, let go and sort of allow my mind to be okay with that.
yeah.
So that may not be the case for everybody else, but for me, it was quite a journey. It took me a few sessions to really get to that space of, okay, I can let go. And what that seemed like for me in my sort of altered state of thinking was that I had to let go of this place and move on to whatever was next, whether it was heaven, another place, whatever it may be, and actually
Mhm.
letting go, opening that door to what you would consider death or a new beginning. And I think that's
Okay.
a big factor. A lot can see it as death, a lot can see it as rebirth, things like that.
And
So,
how does that benefit someone to have that experience? So they come out of it and then like what shifts around? Is it the attachment to, in terms of if you could just explain that a little bit, the ego and how it might shift coming out of that experience.
well, I think in general, the idea of letting go and allowing is what it comes down to. So that is probably one of the hardest things to do. I think we all have that prefrontal cortex that wants to, like prep and plan, make sure we understand danger and risks and all of these things. It's like there for a reason to keep us, alive and organized in some way. And
Yeah.
so when you're doing psilocybin, one factor is that the prefrontal cortex is sort of allowed to relax back, and the
Mm.
emotional part of your brain is allowed to kind of like come out and take over a little bit more. So that's one factor as to why there's an altered state of mind. And so, yeah, when you're talking about ego dissolution, I would say, although I use that word, I also think it's more important to just keep the idea of allowing in mind, sort of
I
what,
like that.
um,
Yeah.
and that's a big part of therapy in general. Can you allow the discomfort? Can you allow
Right.
yourself to feel instead of avoid? And can
Yeah.
you be with the feeling rather than the thought? And can you move through that uncomfortable feeling, that uncomfortable time to move past it? It's kind of the
Yeah.
biggest piece for a lot of things in therapy, especially anxiety.
That's a great way to describe it. Yeah, I
Uh,
like that. I know for me personally, because I've done a few guided psilocybin journeys, it's the experience coming out of, again, not realizing how much I was trying to control things to keep myself safe and really being able to learn to live more in the present moment, which is just such a different way of life. Like rather than constantly protecting ourselves, moving around with that layer of control, to be able to just go with flow is a pretty amazing shift.
Yeah, I think yeah, those are great ways to explain it. And I mean, I even had a big sigh as I heard you say that, just because, yes,
Yeah.
that is definitely a big part of it, being able to be in the moment and be okay with it and
Yeah.
like enjoy it. We can get very caught up. And although this is, specific to me and maybe other parents, although we're playing with our kids and, trying to, like be rough and enjoy and bounce around. Our mind is thinking about what bill I have to pay, who I have to call back, and the rest
Right.
of it sometimes. And so we can get caught up in that. And
Yeah.
these medicines really do help to allow you to be in the moment.
Yeah. That's it. I mean, kids are the best teachers of that, right? It's like they live in the present so much that it's so enjoyable to be in that with them. Because we
Yeah.
as adults are so constantly planning, like you said. And okay, so you have worked quite a bit with psilocybin and with MDMA. I just want to pivot over to the MDMA. So that was originally, we thought would get passed through legislation in August to be legalized. That's kind of the first one set up to be legal next. And then they have psilocybin and then LSD. So can you talk about your work with MDMA with the VA that you're doing right now, what you have seen, and I guess help people understand maybe the difference. There's some different nuances with these medicines. Like why in particular, how are they using MDMA with veterans with PTSD? And what are you seeing in terms of the results coming
Mhm.
out of that?
Yeah, yeah. Okay. This might be a long answer.
It's okay. It's a big question.
Yeah. Okay. So there is an organization called MAPS, and
Mhm.
MAPS has been around for quite some time, done quite a bit of research, and they have sort of created a protocol. And the protocol includes, um, those three steps: preparation, utilization slash ingestion, and then, integration. And that is the protocol that in most research, you're going to find that they follow that protocol with those three steps, taking into consideration, what might need to be there in the room, what a combination of therapists and all the rest of that. So at the basis of all of that is this sort of model. And with that, MAPS, I guess, through their research, through their understanding of all these different psychedelics, chose MDMA to be the one that they focused on the most. Now, why they did that, there are multiple reasons. So I would say if we're talking about, say, for instance, the veterans that we work with now, MDMA was chosen because it is already known to be very good at managing PTSD. When you compare that to psilocybin, does not show the same effects. Psilocybin is known to manage anxiety and, treatment resistant depression, things like that. But MDMA has shown significant progress in managing PTSD symptoms. And so there was this understanding of that. And there was this understanding of a huge need with our veterans. And it just sort of made sense. It's sort of a
Mhm.
bipartisan thing to where everybody wants to help the veterans.
Sure.
For good reason. And
Yeah.
this has been a thing that has shown it can do that. I would say, there's a long history of use in therapy settings. Back before it was made illegal, it was used in therapy. So that was something that was already studied. There's a good foundation there that people started to move off of, those sort of things. Also, I don't know that this is really said much, But with all of that also came the fact that it didn't have such a bad rap. It wasn't as well known. So we all remember the commercial and the like so the eggs on the pan. This is your brain and this is your
I
brain.
remember that.
Um,
Totally. It's
yeah,
frying in the pan. Yeah.
yeah. And MDMA was not really considered part of that piece. It was
Oh, I didn't think about that.
yeah. So when I say LSD, I think in general people have a reaction to that. And the reaction is not
Yeah.
necessarily positive. Yeah. When I say magic mushrooms, people think, oh, like
Yeah.
but when people were kind of taking into consideration MDMA, there wasn't really that stigma. And so I think that might be part of the process as well as to why that one was chosen. But mostly it shows really good, I guess, benefits and results. It's something that can help with PTSD and the veterans, which is bipartisan. And they had already started that process in the 70s. So there's probably more reasons that I'm forgetting, but
Yeah.
that's sort of, a good chunk of them.
No, because I know you and I met through, because we both do ketamine assisted psychotherapy also, which
Mhm.
is, a much different psychedelic. But even with that, it's like my podcast started with education about that. And it's like remarketing the party street drug. It's very difficult for people to grasp the difference of how this can be therapeutic versus used at a rave,
Yeah.
in unhealthy ways. And so I think that's what we're battling is like you said, there's all these perceptions and then there's a lot of misuse. And we're trying to kind of help people see the benefits psychologically when it's done in the right way. What is your opinion as why it didn't get legalized in California? Kind of when everyone, is it there wasn't enough safety profile protocols in place?
Yeah, I remember reading up on that. So Gavin Newsom, it was pretty much approved and then sent to him, and then he was the one who denied it. In terms of why, I don't really remember. I think it had something to do with like protocols and making sure that it was like done properly. I think there was some
Yeah.
study that had been
Which is
done.
difficult because it's got to be set up and it's very expensive to get all the protocols in place, right?
Exactly. Yeah. Which is another reason why I think it was chosen. MDMA is also something it can be repeated or like made into something that is the same in terms of dose. So what you get the first time, you'll get the second time, the third time, and the fourth time. It
Oh.
really helps with FDA approval. And that's why some of the other ones are a little bit more difficult, like psilocybin, because yeah, when it comes to can I get this as a prescription? Can I go get the same amount, the same thing, in 2 months? With MDMA, I think it's a little easier to do that.
Yeah. Can you explain what you're seeing with the VA, patients in terms of like what would be after one? Because generally I know with MDMA, there's usually three medicine journeys that they have as the protocol for
Mhm.
PTSD. But what would be the experience coming out and how is it effective? Like, let's say they've been stuck in flashbacks of what happened in the war and all the trauma that they've experienced. Like, what would you see as being changed after a medicine journey for them?
Yeah. Well, in terms of the VA, we're pretty much at the beginning of that. So we haven't really done many of the dosing sessions yet. But I can speak to it from a lot of my training and just a lot of
Yeah.
so what I understand about this drug is that one, it allows you to increase your empathy, your openness, and your ability to love. It also decreases cortisol, which is your stress response.
Yeah.
So it allows you to be in a space where you can reconsolidate memories, where you can sort of
Mhm.
access something that we'll say is traumatic and be able
Yeah.
to like we'll use the word reconsolidate, shift the way that you view that or feel that, and be empathetic towards it and open towards it and open towards the
Mhm.
people around you and experience something with love and empathy towards yourself and others. So allowing the space is important, and then bringing in MDMA to help with all of that stuff, it can really shift people who have PTSD, because what they have is that traumatic experience is seen differently, is remembered in a different way now. And a lot of the trauma work in general, you're dealing with that stuff. You want them to sort of feel these things and move through them, and they're able to do that with less fear and a lot more safety. So
Okay.
that's a
So
big
they
fact.
come out with new perspectives in a way,
They
like a little
do.
bit of shifts and then more self-love. Because a lot of times, right, they're blaming themselves for a lot that happened in the war, I would imagine. There's guilt, or so they
Oh,
might be able to see a shift change of like watching it happen and realizing like they were in that position. There may have been nothing they could have done, differently.
oh yeah. Oh yeah. And
Those kinds of things.
yeah, there's sort of a combo. There's like a few things at play, because when you're working with MDMA, you're not usually in an altered state. You're not, like going to be inward. DMA, I think, increases socialization for a lot of people and connection. And so
Okay.
there's a big difference if I'm a therapist in an MDMA assisted therapy session versus a psilocybin assisted therapy session. So with MDMA, there's usually a lot more interaction. And
Mhm.
so the therapist can help guide in some ways. There's a use of IFS in many aspects. So the parts
Mhm.
work, where you're allowed to just sort of understand that that is a part of you and then work with that. Also, there's a biological piece, right? So it affects different parts of your brain. It allows for neuroplasticity. It also
Yeah.
directly connects to the hippocampus. And that is a big factor. The hippocampus is known to be sort of the memory hub and the
Mhm.
timeline in some ways.
Yeah.
One factor for PTSD is it's very possible that the hippocampus can go offline in a significant moment of trauma. And then why it can become PTSD as a response and all of that, and you're affected, is because the hippocampus doesn't know that what happened is over yet. The timeline sort of pauses. And
Yeah.
so your brain always sort of thinks like you're in a state of danger.
Danger, fight or flight. Yeah.
Yeah. And so, yeah, with MDMA, its ability to sort of help reconsolidate allows the hippocampus to relax back a little bit and continue on the timeline, knowing that this is something from the past, and then, maybe seeing it differently, not as such a big danger anymore.
Right. What happens at the somatic level? Because we know, trauma lives in the body. So
Mhm.
how does it help work through that part, the medicine journey?
That is, I think, part of the whole like experiencing this different, the way that it
Yeah.
feels moving through that. If you're talking about something that is a very serious moment, an impactful moment in your past, when usually that's something you would avoid because of the concern for what would happen to you, the concern for, your overwhelm, your anxiety, your anger coming out.
Yeah.
And then we add in MDMA, and it allows you to relax, to feel love, to feel sort of warmth in a way,
Yeah.
and then connect that body feeling with what you're thinking in your head as a memory, and to allow
Mhm.
those to reconnect in such a different way to where you're feeling this whole different feeling towards it. That is huge.
Yeah.
Yeah. And oh man, I mean, I'm getting sort of goosebumps just thinking about it, because it's such a powerful thing.
Yeah.
To do. Yeah.
I think that's a beautiful part of seeing people coming out of these medicine journeys is they're more loving to themselves and to others. They're more connected to nature. They're more relaxed in the moment, and the body, I think it's working through a lot of that living in the fight or flight and control that
Mhm.
most people live in, regardless of whatever trauma they've experienced.
Mhm.
Um, so anyway, I love hearing about the work that you're doing because it's, you're on kind of the cutting edge doing the research and also working with the vets, and you'll be ready to go. And it does get legalized, which eventually it will. It's just going to be more time. So I guess, part of my intent is to educate people now, right? Because these medicines are going to provide a new path for healing, but also I like to emphasize the danger of doing it on your own. People are flying to different countries using some of these medicines. I guess just before we wrap up, what would you recommend in terms of whether people are looking for psilocybin journey or MDMA journey? Like, what would you want them to look for in a provider that might be using this medicine?
What a great question. Your comfort is probably going to be one of the top priorities. So, um, like doing something like this, if not done before, might bring anxiety, might bring some concerns. I would encourage making sure that whoever it is you choose to do it with, you feel comfortable with, you have some sort of understanding of the process, and that it feels as though there's a sense of like safety around. All of those things would be the things to look for when you're
Mhm.
hopefully at least talking to somebody. You'd want to be able to talk to somebody, get a feel for how they work, what they do.
And I would say ask how long they've been using the medicine in this capacity, because experience really does matter in
Mhm.
terms of, people really knowing how to use the medicine in the right way, but also it's that personal connection, right? And we've talked about this in previous podcasts. It's like, do you feel safe? Do you feel comfortable with that person?
Yeah.
Because they're going to make a big difference in how you experience the journey and how you're integrating the journey after.
Oh yeah. And for whoever it is that does this, I would also encourage that you prepare yourself, understanding
Yeah.
your own intention, understanding, like what's moving through you, preparing your mind and your body are big factors. Big
Yeah.
when you utilize these medicines.
Yep. Yep. All right. Well, thank you so much for joining me. Is there anything else you want to add as we wrap up, or you feel like we missed?
I don't think so. I think there's so many things, right? We could talk about this forever.
Hours. I know you and I had fun yesterday talking
Uh,
about it.
yeah, there's all these
So
different.
many different rabbit holes we could go down. I just, oh, go ahead.
No, no, no. I would just say thank you. Thank you for letting me come on.
Yeah.
It's been great. This has been a good intro to a really important thing, a really important topic.
Yeah. Well, thank you for working in the field and all your experience, that you have in all these different arenas. It sounds like it's coming together and you're able to help people in such a unique way because of all your training and personal experience. And so, I mean, it's wonderful that you have. So we're going to put your information in the show notes.
Okay.
You only work with people in California. Is that correct?
Yes.
Because your license is in California. But if they want to contact you to ask questions, we'll have your, website and contact information on there. We look forward to, I'd love to have you back maybe the farther along you get in doing some more work with the veterans just to see how that's going at
Oh
some
yeah.
point in the future. But thank you so much for coming on and joining us. And it was great to talk to you more today. I'm sure you and I will be in touch personally.
We will. Thanks again.
Thank you, Nina. Well, have a great rest of your week, and we will see you next week at Catalyst for Healing. Bye. Sorry, I'm going to figure out how to stop the recording. Here we go. Stop recording.